So, welcome everyone to yet another episode of SPAG Fin's D-Log Season 2. I am particularly very excited to welcome my esteemed guests for this discussion today because we are commemorating the International Day of Action for Women's Health. Action is the key word here, and I think the way we are passionate about women's health, we really want to have an insightful discussion on while what the challenges are. We want to move from the discussion mode to the real life implementation of what needs to be done to really implement action and bridge this gap of women's health care and bring in equity. So I have the right ingredients, I have the right intent, and I have the right experts to do that for us. Innovation in women's health, from newer treatments to new technology to community-based interventions, all these aspects hold a lot of promise in improving outcomes and improving the overall well-being for women. But what's lacking somewhere is adoption. And as active advocates in women's health, I think each one of us, including women who are not maybe advocates, but who are the end beneficiaries, need to be able to play a role in here. And this day actually gives us an opportunity to delve into the discussion wherein we are trying to find out solutions, where we are trying to find out what is the way forward, what is the roadmap that needs to be taken. Our webinar, Building Communities, Mobilizing Action for Women's Health, gives us the exact opportunity to do that. I would quickly take 2 minutes to introduce our esteemed guests who have been really helpful in coming together on a common platform and provide us with their experiences, with their insights that they have gathered through their several years of work in the area of healthcare, in the area of social impact. I'm pleased to welcome Ms. Jasrita Dhir, who is an esteemed figure in the area of marketing and communications. She's serving as the Director of Marketing and Communications at Karkinos. With her extensive experience, Jasrita has been at the forefront of advocating women health-related initiatives, driving impactful campaigns, and fostering meaningful conversations within the healthcare community. Welcome, Jasrita. Thank you so much for your time today.
Thank you, Ritika. Thank you for having me.
Great. And I'm pleased to welcome Ms. Geetika Bangia with us. She's truly a trailblazer when it comes to communications. Today, she's the head of corporate communications at Stryker India. But I personally know how she is invested into this cause of women's health and overall, women empowerment. Geetika's strategic vision and leadership has been instrumental in advancing the dialogue on women's health. As we talk through the discussions, she will be able to bring in her experience and insights, which I'm sure will be very, very comforting and very important. Lastly, I'm delighted to welcome Ms. Aanya Wig, a dedicated advocate for women's rights and co-founder and managing director of Her Haq. Through her tireless work with Her Haq and other community-driven organizations, Aanya has been a catalyst to drive change, empowering women and communities to demand equitable access to healthcare and reproductive rights. So she definitely brings a perspective. So you see, I think collectively, these three women bring in a lot of experience, and I'm really excited to start this discussion. So let me, when we start this discussion, when I was planning this webinar, Jasrita, Geetika, and Aanya, the first question, that came to my mind was, are we prioritizing women's health enough? And I think that's the first thing that I would like to bring on the table here. And I would like to know your perspective on this. Are we really prioritizing women's health? So, Jasrita, maybe you could provide a perspective on that.
Yes, I'm happy to. First of all, thank you. Very, very pleased to be in the company of all these August women. And you said three, no, actually there are five. The other are Divya and Ritika. Yeah, so thank you. Yeah, your question is on the money, is on the money. No, the answer, as far as I look at it, is a resounding no. We are not prioritizing women's health issues enough. You spoke about the McKinsey report, but you also, if you look at the Lancet report that came last year, which said Women, Power, and Cancer, the title says it all, even if you don't go through the fine print, right? It says that the power is so concentrated in corridors concerning women's health that we are stopping access to women, right? Women are not getting, and this is a study which is in across 70 countries. There are low middle income group companies, there are countries, and there are high income countries, but that disparity remains, right? Of course, some countries do better and some do worse off. But the fact is that no, we are not prioritizing women's health issues enough.
And I think for this very reason, it's important to have these forums wherein we can reiterate that why it is important to prioritize women's health and what needs to be done. Geetika, I would love to hear your perspective on this.
Sure. Thank you so much, Ritika. And first of all, it's a pleasure to be here on this wonderful forum with these lovely ladies here. Uh, when you just started with your question, and I just picked up one word from there, that whether we are prioritizing women's health enough. That's exactly, your question was. I would like to pick up at, a probably different perspective. And I completely agree with Jasrita here that yes, the answer is no, we are not. But this gives me one trigger here. You just mentioned that it's are we prioritizing? Now, who all are these we? Who all fall under this we? That's WE. People around us, society, the setup around us. Some can be supportive, some can be non supportive. It's just a matter of choice. But this we, the first and foremost, is it has the you, which is you and me. That's I. And the first question that comes to my mind is, do we as a woman, or I as a woman, are we really seriously taking, health as a priority for ourselves? I don't think so. And I'm not just talking here about physical health, mental health, financial health, or probably emotional health. It can be any kind of, maintaining that good health. But before talking about we as a society, as an environment around us, I think it is top priority that we first think about the I. The I comes first when it is talking about prioritizing your oneself, right?
Yeah.
Women, we all as women, we all are extremely serious about the health of our children, parents, spouse, peers, friends. We all are thinking about that, this person near me is in good health, not so good health. Do they need help? But have we taken a step back and even ever thought about that? Am I taking good care of myself? Am I taking time out to take care about myself? We are actually not doing that. And then probably I would like to add to Jasrita's point that yes, that's the reason probably enough is not being done. It's actually not being done.
Yes. No, totally agree with you. And I think it starts with every individual, and then collectively it'll be a force that comes together. Absolutely. Very, very, important point. Anya, with what is your perspective? Because through your work, I see you engaging with different cohorts of women. So what is your perspective on this aspect?
I think both of them put it very rightly that we're not focusing enough on women's health, and I think we say it time and again. But I think Geetika made a great point, right? We have to break down what women's health means. It doesn't just mean physical health, it has a lot more to do with it, and a lot more beyond just being physically okay. It is to do with access, it is to do with health insurance, it's to do with your emotional needs, related to sexual needs, reproductive needs, and so much more. And especially on ground, what I see is that um, women tend to brush off any health related issue that they have, especially if they come from communities that are marginalized, because they'd rather save that money for doing something else or save that time doing something else. We see the long lines in community and government hospitals, so they're very less likely to get any sort of regular checkups done. And the other problem is that there are so many taboos, especially around sexual health, that women tend to ignore what's happening to them or not to talk about it at all. And I've seen that more and more on ground, and especially with adolescents as well. They tend to ignore things that are happening to their body in terms of puberty, changes that they're going through, and even related to pregnancy, safe sex, so many other things, that a lot of these topics are so full of myths and taboos that people don't want to talk about it, and even when they want to talk about it, they don't have the money or resources to access kind of any sort of advice or any sort of guidance for it. So the barrier is big. The topic is huge, but the inequality and lack of access is even bigger.
No, absolutely. Please hold on to that thought, because you bring in a very important perspective that definitely is part of the discussion. Just before that, Jasrita, you mentioned about this World Economic Forum and McKinsey report, and we were talking about it yesterday. A very interesting data point, that I found as part of that report was that women spent 25% more of their lives in debilitating health compared to men. I also read in that report that what lacks is there is very less investment in data and research for women specific conditions, say an ovarian cancer. So, what do you think needs to be done to enhance this investment in women specific conditions, in customizing the way we approach women's health for women? So it's very important to take a step back and understand that what are the problems that exist, and therefore where the investment needs to go. So any one of you who wants to provide a perspective here, please do. Jasrita, Geetika, Anya.
Yeah. Geetika?
Yeah.
Yeah. Go ahead, Geetika. After you.
Okay. Thanks, Jasrita. Um, very strong and a very valid point, Ritika, that you've just picked up. And yes, we have umpteen number of reports around it. And when we talk about, you know, whether it is our society, whether it is the socioeconomic conditions, be it anything, again, picking up the point that I left in my previous question, but the previous answer, that before you can do anything for me, I need to be ready to do something about myself. That's me, right? And the kind of society we delve into or we are operating into, we are not comfortable sharing very quickly things, especially women. We try to, a lot of apprehensions. Who's going to say this, or someone is going to judge me for this, or someone is not going to listen to me. And, that comfort level doesn't come. That's where I strongly feel that, awareness and education, it is extremely important. And you picked up the point, and I think Anya also mentioned it, that community building, that's where Anya just left that point there, that community building, it has to be it needs to foster awareness and education, creating spaces for conversation, open dialogues, knowledge sharing, have one-to-one connects with women and who are marginalized, and the kind of, the wonderful work Anya's organization is doing. And not only does these kind of organizations, but we all, even at an individual level, we can just help to break down those stigmas and challenge those misconceptions. So
Yeah.
that's what I feel is that, even if you are not that comfortable talking about an issue to, could be your mom, could be your friend, could be your colleague, could be your peer, or just could be anyone around you. Education and awareness, I think, are of utmost importance and priority right now.
Yeah, absolutely. And community-based interventions that are based on, bringing together women and spreading
Yeah,
awareness, mobilizing resources has actually proven to be cost-effective strategies, right? So,
indeed.
and I know for a fact, Jasrita, like we were speaking yesterday, you did mention that, here you would like to talk about some of the initiatives and the groups that have come together. Anya, definitely I would like you to, further build upon this. So, Jasrita, maybe we'll start with you on this whole aspect of community-based interventions. What is the role that community-based interventions can really play in spreading awareness, in mobilizing resources?
Right. Really, I think the work Anya and her organization are doing, it'll be great to, if I can defer it to her, let's listen to her. And I would love to build upon it because I do have 3-4 points to add. Anya, please, after you.
Thank you so much. And I
Absolutely. I
think
would love to hear from Anya on the community building piece.
Yeah.
all of you were so kind. One thing that we love to do on ground, and I feel like is so important, is comprehensive sexuality education. And what we try to do, especially, is talk not just to girls and young women about menstruation and puberty, but also bring in boys in that conversation. And what we try to do even more often is have men and boys take those workshops. We find it harder for men and boys to join our organization and talk about these things. But what we realized is a lot of the taboos, a lot of the stigma starts building when you were younger. And I don't know if it happened in everybody else's school, but when I was in school, we were in eighth grade and we were put in separate classrooms and told about, oh my God, you're going to have periods. And that's it. Nothing more, nothing less. And I know that in so many schools, this still happens. And this is about schools that come from a certain economic background. They're probably schools that are much, that a very few minority of people go to in India. The mass goes to schools, right? This is a conversation that is in no way happening there. And we started to realize that the kind of questions that boys have, it goes from curiosity and then it builds on to bullying because they don't know how to deal with it. And even in homes, right, we tend to put so much responsibility on institutions to talk about things, to address issues, but we often take away what's happening inside homes. We've seen so many examples where a son may go up to a mother or a sister, ask them what a pad is, and they take it away, say this is not a thing to talk about. Conversations on dinner table never really revolve around things that related to women, or they don't even actually have a say in a lot of these matters, right? So what we've tend to realize is when you go on ground, having a community or talking to women along with men and boys makes a lot of difference. Having sons, especially in the room with mothers or their fellow classmates, really breaks the ice and makes them understand from a very, very, very basic point that how there is a difference in bodies and what tends to happen to women may not happen to them and how they can be there for them. And I think allyship is a big, big role that community building can do. And on the other hand, I come from LSR and we actually have a big community of women that are on a lot of these groups. And we've built a health group as well, where we have collaborations, of course, with a lot of hospitals to give discounts to women. We also have a health insurance, especially for women and dependents of women. So be it their husbands, their in-laws, their parents, and their children, which is something that rarely happens. You just have a spouse or a child that's included a lot of times. And we've also seen that women tend to be dependent on their husbands for a health insurance. And they often don't buy it themselves unless they're working at a place and it's covered in their salary or a lot of those other things. So we're trying more and more. And of course, through digital technology, conversations are so much easier to have where women are freely sharing what they're going through, even if it's a topic that's really sensitive and they would ideally be really shy in a general conversation. These groups foster a safe space where at least they're talking about it. And of course, the next step goes on to diagnosis and them seeking help. But I really feel community building gives women a safe space, and of course, build, busts a lot of myths and taboos that are especially on ground. So maybe a mix of all of these things really helps to uplift people, but also make them aware of so many things that women go through.
Yeah,
Yeah, yeah. And I really like the
that's
word.
brilliant. Now, if I could just add to that, thank you, Anya. I think, yeah, please go ahead. Go ahead, Ritika.
Yes, just yeah, I was just saying I really like the term the safe space part of it. I think that was a great point. Yes, Jasrita, I would really like you to build on it.
So two parts to my answer. First is, the first question you asked is, what needs to be done for this action? What can we do, right? And the second part is the experience with communities. I think on the first, I would say, and picking from what Geetika said, what can we, women who are born into privilege and women who have had access to education and healthcare, what can we do? What can we as a community, the community of us women do? The second is, what can we do as part of the families that we live in and as part of the organizations that we work at, a slightly larger group? And third is at an overall, civilization or a community, whatever you want to call it, at that level. First, I think, and I don't have a better example, we've flown hundreds of thousands of times. But every time we are told, the first message that we are told is, in case of a turbulence, first put on your face mask and then try and help your babies or elderly around you. If the same approach can be applied to healthcare, first take care of your health and then think about your husband and your mother and your father and your, in case of pet parents, pets, children, whatever, what have you. I think the first thing, if we can just drive this message, and this message needs to be driven just the way the flyers are exposed to this messaging every time they fly. It's not like, these are people who know it, so chalo, let's skip the message. Inko to pata hi hoga. No, right? Even if we know, we need to hammer that message. I think that's the first thing that we can do at our level. Second, those, to Anya's point, the real Bharat that stays beyond these corridors and beyond our echo chambers that we live in, what can we do? And I think she touched upon the point that I wanted to, which is start involving men. And it is not just at the stage of boys. She's absolutely right to say start at that stage. But I'm saying not just for only, your menstrual health, but in every decision. Because if we do not involve men first in the discourse, right? Look at this, right? We are having a panel today. We are discussing women health, but we just have a panel. We don't have a man here, right? It's not a complaint, but I'm saying till the time this keeps happening, that they're not part of the discourse, this will be seen as a Mahila Manch. This will be seen as a Mahila Morcha issues, and will continue to be on the fringes. If we want to mainstream it, we have to involve men in the discourse and then in the decisions, right? And here I'll take in the deliberations as well, a simple example, right? When we go for cervical cancer vaccinations and when we go to the rural areas of Telangana, AP, wherever we go, wherever it's happening, right? We realize that in certain communities, in certain places, the more you go into the remote areas, the women are never going to come. Even the mother does not have that agency to bring her daughter herself. They're always going to be accompanied by a man. So what do? You start talking to men as well. You have communication which is addressing the men as well. You tell them the woman of the mother can get screened for it. The daughter can get the vaccination. And while you're there, we'll test you for oral cancer. We'll test you for prostate cancer. We'll do a simple test for a man, whatever. Involve them in some way so that, you have that the access, that barrier is broken, that barrier to adoption. So that's a second thing that I would say at a family level that we can do. And third, I would say, I think we have to start demanding a slice, a pie. In momentous events, right? I love the name of the organization of Anya, which is Har Hak. And if we can say that, I think we have to organize, we have to agitate, and we have to say, Sada Hak Ethe Rak, right? It's too long that you've, kept it away from us. I think that's what we have to do. So this is what we can do, okay? At a community level, I don't think we're doing anything different. It's a similar template, and that's the template that works. So do that, because that's a, you don't need to just improvise too much on it, because here we apply the principle of do not try to change something that's not, do not try to fix something that's not broken. This works. Do health camps with local communities, with at a block level with ASHA workers. That works, right? Because there you have the trust of someone. You're going with someone that they trust, right? They're never going to, when it comes to decision of life and limb, just going to speak to someone who's a big corporate or a conglomerate, etc. No, trust is important. So I think that's number one. Number two, local influencers and community leaders. So we do this integrated village development camp on the border area of Karnataka and Tamil Nadu. And there Mr. Francis leads a 6.5 lakh women in self-help groups which are there. So the community advocates involvement that happens, the local NGOs who've been working with women for 20, 30 years, maybe for water, for sanitation, for hygiene, for whatever, but they trust them with their issues, right? So go with them. That's the model that works. And use of community radio, I want to bring in here, use of nukkad nataks, etc. in all of those areas. These are the kind of things that at a community level that have worked for us. And I'll end by saying that the most sustainable form of change comes from peer groups only. It doesn't come from that adult to child conversation or, at a higher ground. So if we want it to be sustainable, we'll have to have it from people from the community. We'll have to ride on their trust. It's best when it is peer moderated. So the power of community can't be overemphasized.
Absolutely. Can't agree more on this, Jasrita. I think very well said that we need to define who my messenger will be. People who are trusted, people who are part of that group, right? And our tools. So, like you said, bring in the radio, bring in, awareness camps. So, who is my messenger? What is the story that I'm telling? And how am I telling that story are very, very important aspects to consider for the success of any initiative, of any campaign that we as leaders are trying to do. I will, because we are talking about Anya, like you touched upon the whole sexual and reproductive health aspect, right? And we also spoke about that how there is a stigma associated to it, there is a taboo that is associated to it. I would like to connect it with something that we have spoken about as showing results in healthcare, which is digitization and AI. So we all recognize the value that digitization and AI are bringing into the healthcare system in terms of efficiencies, in terms of personalized healthcare. I'd like to discuss that in the context of sexual health and reproductive health, because like we said that this is an area which is already stigmatized, right? There are, while it brings opportunity, there are also certain risks, like in any other sector in health. Digitization and AI do bring in certain risks. So because Anya, you have been working in this area very, very extensively, I would like to start with you, that how do you think digitization and AI can help in advancing the narrative around sexual and reproductive health? Are there any risks that you envision, and if there are, how can we address those?
Absolutely. I feel like the first is definitely shifting social norms and attitudes of people. And I'm not just talking about men and boys, but I'm also talking about within women. There are a lot of taboos and myths that people have. So, what we at least try to do is have informative campaigns online, do a lot of advocacy online. But what I try to do on a personal level is also talk about topics that are irksome or are ideally supposed to have behind closed doors, and people are not okay with having those conversations, be it about any sort of thing related to menstrual health or sexual health or comprehensive sexuality education. And I think what one thing that has really helped through technology and AI is being able to reach to communities where I couldn't physically travel. And this is not just for me or my organization. A lot of these campaigns, a lot of training that people do online, what we've tried to do is a lot of NGOs now and a lot of schools now, of course, have access to at least one system or one laptop within their vicinity, especially after COVID. So we try to address people even from the most local regions and most regional places across the country, even if it's a village in Rajasthan, and talk about things that they may not be talked to about, things that they don't know about. And especially when it comes to sexual health, it's a topic that most people are very uncomfortable talking about or even taking training in. So it's really helped us reach those challenging areas that are really far away, challenge stigmas and norms around it. But at the same time, I feel like it's also helped us understand, and again, coming back to the safe space point, online communities, I feel like, have played a very, very big role for women to acknowledge their own health. Even for the HPV vaccine, we saw so many women talking about it, and suddenly there was a growth about women taking the vaccine, right? And it all started when people posted online. We saw so many social media influencers talking about it, actors talking about it, then that being covered in news, having special channels. All of these things started happening because somebody realized that this is something that they need to tackle, and one campaign could really change the way women look at it. And of course, we've also seen how in different states they're also trying to make the vaccine free or reduce the cost of it for women, because like we said, it's not just about healthcare or knowing about healthcare, it's also about access. And the HPV vaccine, for anybody, any normal Indian woman who's an average Indian woman, it's very, very expensive. But yes, just one tiny point is, of course, safety and privacy is a big concern. So a lot of the
Mm.
apps that we use to either track our periods, to track our sexual health, a lot of these apps, Flow or be it any other app, we tend to see that data is something which is so sensitive and also so essential to be handled properly. We see a lot of these apps that not just help you track periods but answer a lot of these queries, right? Online consultations, a lot of these things that have made healthcare more accessible, but data handling is still a very big question, because the data and privacy laws in India aren't as strict as they are across the world, especially in the western parts of the world. So we don't know what happens to that data, who sells it, what access do they have. We've seen from other applications that data is sold to advertising companies, and on the basis of your information, you're sold products, right? You constantly get these advertisements. So I still feel, of course, the online world is a great, great savior, but we still need to understand how to regulate it and make
Yeah.
sure that our data is actually safe and private.
Yeah, totally agree, totally agree. Geetika, Jasrita, would you like to add on to this?
Sure. I would actually like to pick up one of the points that Jasrita mentioned, and it has remained in my mind since she spoke about it. Hammer that point. So, Jasrita, I'm
Mhm.
picking up that word from you. And I, of course, thanks to the amazing onset of the social media rage that we have around us, especially after 2020, the year that no one can ever forget in the history of mankind. Um, Social media, any kind of video platforms, I strongly feel that education and awareness, and Ritika, I'm again picking up those 2 points again, that education and awareness campaigns these days, social media is undoubtedly the most used and the most wanted platforms right now. You have such plethora of content out there in the form of videos, in the form of any kind of a reading content that you have. There are so many interactive websites. You have apps, which just Anya just mentioned. And, they have to quite an extent, they have a lot of accurate information, which is, of course, to some extent, it is culturally quite sensitive information as well. And the content which is more relevant, it has addresses to the various kinds of myths around the various the sexually uh, uh, diseases that are around there, which the people are not aware. They do have information, but probably they do not have the complete information about it. Raising more and more awareness, promotion of healthy behaviors, that how can you make oneself or even your family first, as that first put on the mask on you rather than first helping the others. So you need to take care of yourself first, and promote healthy behavior begins with you, and then you can ask or spread that across within your family, your friends, your peers, and everyone else. Creating those kind of campaigns which impart education and they create awareness, and definitely it starts from home. And I would just like to share a personal example here. I'll just take 30 seconds more here, Ritika. So
Absolutely.
I'm a single mom and I'm a mother to a 20-year-old boy. So he's an adult. He's not a boy anymore, and he hates when I say boy. He's like, I'm not a boy. And these are the elections that he's going to vote for the first time. So he's 19 and a half, and he's going to vote for the first time. So he's pretty excited. And to Jasrita's point, when she mentioned it starts from home. So I make it a point that even if it's a mere taking a financial health decision, that even I have to open an account, or if I have to invest a money in a very normal mutual fund or something like that, I involve him. And he sits with me, and we take out information that, okay, mom, this looks good. And he comes from a commerce background, so he understands those, the verbatim and those points much better than me. Somewhere down the line, just Rita, I am like totally okay, bizarre, I didn't understand this. And he's like, don't worry, I will help you on this. So involving him right from the beginning, I felt that, and now it's that stage, Ritika, where he himself, gets interested and he comes up with options to me. That, what, this is, mama, this is going around. And, why don't you, you could invest here, or you could do, you can put your money here, even if it's a little bit thing. So it adds on that, the thing in the family. And he,
Yeah.
as the, well, he loves to now to be known as the man of the house. He's not a boy
Man of the
anymore.
house. Totally.
And he takes and he participates. And most
Hmm.
of the times, ladies, he really helps me on that. So of
So
course, there are
to build
other
that
factors
strong
as well
foundation.
which I involve him. So,
Hmm.
but this was one of the points, it was a personal thing that I wanted to share, that it actually starts from home. To Jasrita's point, and that was one point, Jasrita, I just picked it up and I was like, one last thing that I would like to add here is, Ritika, consistency in whatever we do is the need of the hour. We just
Hmm.
cannot say that today is Women's Day and we are going to talk about on 8th of March. We are talking about mental health. We are talking about financial health. What are we doing on 9th of March? That is my question. Are we
Yeah.
really consistently talking about it? We lose that path. It
Yes.
might go on for like another few days, but then we all get so much engrossed in our daily routines, it just goes flush. So I
That
think consistency and continuity in raising awareness and education through various platforms is the need of the hour. That's how I would like to sum it up here.
great, great. And I can't agree more, because we, as we all share one common thing here, that we are communication experts. So we understand that the consistency of delivering the message, and like Jasrita said, hammering in the message, and of course the story will evolve. I always tell that it's kind of a building block strategy that you do. That, okay, maybe in the first part of the storytelling, or in the phase one, maybe you are talking more about the problems, and then you bring in the solutions part of it. The story keeps evolving, but you have to continue to tell the story. Your content strategy, your channel strategy will also evolve, but it is a continuous process. Totally. Totally. I think some very good insights, and because and we have spoken about how communication can play a role. I just want to really ask that question specifically, because we all are storytellers, and I have been part of various social and behavioral change campaigns, even during COVID-19, when the pandemic struck us. I really crafted and curated those campaigns, wherein we wanted to create those nudges and those behavioral change when it came to sanitation behaviors, when it came to COVID-19 appropriate behaviors. Similarly, when we talk about women's health, and we did start on a great point, that it starts with us, it starts with that one woman prioritizing health. So how can communication strategies really help in bringing about this social behavioral change, bringing about this belief shift wherein women themselves are asking the right questions, wherein women themselves are taking that initiatives, and then of course the other stakeholders in the ecosystem, working towards addressing the challenges that exist and taking timely and appropriate action. What is the role of communicators here?
I think a lot of onus does lie on us, right? And while the task that you are outlining sounds very momentous, but it has been done in certain areas before. It's not like it's not been done before. And it's been done in areas that have been considered taboo concerning women's health earlier as well, right? But I think it's the attitude, and Geetika did talk about it. It is not impossible, but as communicators, as women and as women communicators in these three capacities, we have to keep chipping at it each day, every day. This is a several years long project, and in certain areas, in some, it could be a decadal project. It's not a seasonal campaign like she was talking, right? So there's no room for either impatience. Why aren't results coming? Why isn't the needle moving? There's no room for impatience, and there's also no room for inertia or complacence to sort of settle, right? So I think the attitude with which we approach it is going to be number one. Taking some examples, of where it has been done earlier in the past, right? And we've seen that happen is 90s. As a 90s kid growing up, we saw AIDS. AIDS was a big sport, and we had people, at that time it was thought, the myth that was propagated was to say that it spreads through touch by just touching somebody who has AIDS, right? So we have the biggest actors of the country touching someone who they said is an AIDS patient and saying, I'm just fine, right? And because I think some of these campaigns also did work because that was not the age of proliferation of screens. You had one national sort of network, everybody would log on to it at one time, and you would again keep hammering the message every day with different sort of torch bearers and leaders, etc. The campaign of, about AIDS, the myth busting campaign was a very, very successful campaign, right? Recent times, the Jeevan Bundi iodine campaign case study, where we say 70% of the women, rural, urban alike, are deficient in iron, they're anemic. So the simplest thing that you can do, and marrying it with the cultural practices, is to give that iodine bundi, right? So brilliant campaign. But where does it falter? Is that you started that campaign, but there also needs to be a follow-up. You need to go back to the same women and test them and see that how much of a change it has brought. It can't be just a campaign. It can't be a seasonal thing. Somebody started that. Now it's in the ecosystem. And now it's for all of us to A, hold our feet to fire and say, we will see it through. And B, to, for it to gain momentum. The best campaigns are the ones that get a life of its own, which are not resting then in the hands of the creators only to keep feeding them. But that's not self-sustaining. Right? That's what we can do as communicators, right? Today, I am a believer in Anya's, that she's trying to do. And I'm professing and putting my hand up and say, whatever I can do, I would love to do, okay? So much respect for what Geetika and Anya's mom. And this is how the movement sort of, keeps adding on. So if we say that every day, no matter how difficult the schedule is, whatever we are doing, we are going to convince, and we are going to include 2 or 3 more people in this chain, men and women alike, right? That's our beauty as sort of communicators, to do that. This is what we can do. This is the power of communication in my view.
Beautiful, beautiful. I really like that thought, that this is the power of us as communicators. Yes. Anya, would you like to add anything here?
I was just saying that I feel like representation in campaigns or communication is so essential. One funny activity that we do when we go offline is we ask the kids if they've seen sanitary napkin ads and if they've seen the blue liquid that they pour in. And we've told them that if by any chance you're on your period and it's coming out to be blue, then that means you're an alien and you have to go to the doctor. because they don't know. A lot of these students have never had these conversations with their parents, and we also do this tell us your first period story, and a lot of it is always so depressing. Nobody has a happy first period story, or nobody has a story where they say, oh, I knew it was going to happen and it finally happened. We've of course seen these one-off instances where there are states in the south where they celebrate it, right? And you've seen these viral Instagram stories, but nobody talks about these viral stories where women think they're going to die if they get their first period. So many people have actually died by suicide. Trigger warning. When they thought that something is wrong with them, people feel like they have cancer. They don't share with their family, end up having so many other diseases. There's so much more that happens when you get your first period. So I just feel like representation is such a strong thing. If a big brand can make an advertisement about periods and about sanitary napkins, and that's their sole product, I feel like they really have the power to also show what color blood is, because we see it in movies, we see it when some actor shoots another actor. I don't see what's the harm of pouring red color instead of that blue color. So I think Jasrita has covered everything really well, but I just feel like representation could play such a strong role in communications by bigger brands, especially because they really have the power to change minds, or at least trigger conversations within communities.
Yeah. No, I think I completely agree to what you are saying, and we do share period stories, and very rarely do we find like a period story which is, fun to share. Of course, there is a lot of uh, uh, inhibition that is attached to it. With this, I think we come to the close of this discussion, and we can go on and on. And I think we should keep, touching base, because a lot of good insights came out of this discussion. Just recapping few points that I kind of jotted on. The first and foremost, it starts from us. It starts from every woman to prioritize health for herself, and it starts from the home. So we need to create that ecosystem that facilitates, that activates and prioritizes a women's health. So we need to start involving men. We need to start involving our boys. Even my boy is 14-year-old, and I need to start involving him. And he does understand, when one of those days when I'm feeling low, I have my stomach cramps, he understands that, this is something that, my mother is going through, and I need to give her that kind of rest. So it's not a taboo that we kind of make up that, okay, I'm just not feeling well. He understands that it's a monthly affair that will happen, right? The other important thing that beautifully came out in our discussions is, we need to hammer in the messaging. It is not something that is a peak that is sporadically discussed around these important days. It is a consistent effort that we need to make and hammer in the messaging, which needs to evolve, as we find success. We need to involve the right stakeholders in our discussion, people who can be trusted, people who are the right influencers, to make women and to make the other stakeholders believe in what we are trying to do. So all in all, I think we had a very, very good discussion, and I thank you all for finding out the time to have this important, to be on this webinar. And I hope to continue on this discussion next time, Jasrita. Whenever we are discussing women's health, I will definitely like to have a man and get that perspective, because it is important. It is absolutely important to do that. And women's health is not something that ends with a Women's Day or an International Day of Action for women's health. If the action needs to happen, then these constructive discussion needs to happen. So thank you so much. And yeah, I mean, I would love to continue this discussion even further.
Thank you, Ritika.
Thank
Thank you
you.
so much